is Abul Majur. I'm a security associate, security analyst. Yeah, I'm into safety and security risk management. Apart from my work, I'm a mother to a boy. Yeah, and it's really amazing being a mother. At the same time, crazy. But yeah, I'm a mother, and that's it. Well, yeah, that's one of the most curious things that I experienced this year. So apparently in May, I started I just did not feel well. My body wasn't I just couldn't do a lot of things, and if I do, I get anxiety, I get palpitations, and all these signs of something wrong with you, Yeah, so by that time I was in the field, and I did not know what was happening with my body. And South Sudan, we don't have enough equipment and enough professionals in the field of medicine. Nobody got to identify what was wrong with me, but I knew that there was something wrong with me, that thing of something's wrong with you, Yeah, but then what happened, I started having blood pressure problems. My blood pressure would go up, sometimes it would just drop, and I can just wake up in the morning and I start having palpitations, like your heart just beating so fast and all that stuff, And it was quite scary for me because I really never understood what was wrong with me. Yeah, so thank God that period is when I was coming back to Juba for my leave. So when I came to Juba, the first thing that I did, when I came from the airport, I went straight to the hospital. Because even before I came to Juba, my colleagues were telling me, you have to hold yourself strong or else you'll not be accepted, to board the plane and all that stuff. Yeah, so I wasn't really feeling well. I was just holding myself together, Yeah, so when I came to Juba, I went to the hospital and I did a full blood checkup, and the doctor told me, you're fine, there's nothing wrong with you, And then I was relieved, maybe it's just anxiety, and also that I miss home, and all these things, Field can actually be stressful, I don't know if you've ever been in the field. I mean, spending 2 months in the field, it's quite exhausting, So I came after the first checkup. I stayed for a week or something like that, yeah. And then still I had palpitations, like my heart would start racing. I think the normal heart rate is 60, and it's between 60 and 100, But I would just be sitting and my heart rate goes to 160, That is so scary. Yeah, but then I went back for another ECG and they told me, no, you're fine and all these things. My boyfriend confronted me. He's comforted me. And it's like, no, everything is okay and all that stuff. So I was like, okay, fine. Maybe it's just me being anxious and all that, But then still, I just wasn't feeling well, And something about South Sudan, I feel like a lot of people are misdiagnosed. You're given treatment for a disease that doesn't exist, or a disease that you really don't have, Because for me, I said I went under treatment of malaria and typhoid, Yet I never had all these things, yeah. So the good thing, I'm privileged that I have access to international community facilities such as UN, Yeah, so I went into the UN clinic and they were able to identify that, you could have a structural heart disease. After some x-rays and ECGs, they identified that there was a problem with me. And later on, they told me they don't have enough equipment to examine what the actual problem was. So they referred me to Nairobi, to Aga Khan Hospital. So it was just so crazy. In 2 weeks, you are a normal woman to you may have a structural heart disease, And a lot of things were happening at home. I lost my auntie. And that same day that I got the news that I may be having, that I'm being referred to Nairobi, is the same day that I lost my grandmother, And my family could not even mourn because they fear that if they tell me the news, I may suffer heart attack or I may suffer stroke. So it was really difficult for everybody, for my mom too. The fact that she lost her sister and then she lost her mother, and then the daughter comes home with the news that she has a structural heart disease and she stands a chance of having open heart surgery, and it was just really crazy in that period. A lot was happening, and honestly, I really didn't know what to do. Yeah, so that's what happened from the point.
Yeah, what is a structural heart disease?
Structural heart disease, it's a lot of things. It could be that you have a valve problem or your heart. It's just any problem with your heart, Yeah, something to do with the mechanical function of your heart. I think that was what they meant. That's what I read and Googled about it, because my friend, the moment they told me I have a structural heart disease, I went on Google, my friend. I almost died.
What are you Googling?
I was like, structural heart disease. And my friend, Google is very dangerous. When you go there, Google structural heart disease, they even tell you death. That's the first thing, death. It's just so crazy, yeah. So structural heart disease is literally problem with your mechanical function of your heart, something like that, yeah. So that's what they believe, but they never knew it could be they put there it could be arrhythmia, or I had a valve problem, or a deformity. Maybe I was born with a deformity, something like that, yeah. I'm not a clinical person, but that's how I understood it, yeah. I think in 4 days or so, I left on the 1st of June. I went to Nairobi. I arrived in Nairobi and I could not walk kwaje. Like the moment I have 1-2 steps like this, my heart just goes up. My pulse rate just goes up and I have to stop, Yeah, so I got wheelchaired from the plane to the ambulance, and then from there I went straight to Aga Khan University Hospital. Oh my God, there was so much going to my mind at that time. I thought a lot about death, the possibilities of me not making it, because when you're in that dire moment, as young as I am, I'm young, right? I look young, right? Yeah. So as young as I look, and I could have suffered the risk of a stroke or heart failure or heart attack. Like my chances were way up there. Yeah, so for me, every time I was just so anxious. Death was just there. Like, Abul, you may get into that. That's even before they say that I would have a surgery and all that stuff. But for my own research, surgery was like something you had to go through, Yeah, so I was so scared. I thought a lot about my son. I was like, okay, if I die, so who's going to tell him the news that I'm dead? Okay, how about my mom? How's she going to feel? She lost her mom. She lost her... I was just thinking about everybody that I love. Thought about my friends, It was just really a scary moment for me, honestly speaking. Yeah. So I go to... I was just scared. I was just scared most of the time. Yeah. We went to Aga Khan, so actually arrangements were made before arriving to... Oh my God, I'm so privileged. I was so privileged at that time, So I know, actually, when I was going through all this, I was thinking, how about those people who have no access to such facilities? Just imagine if I never worked with this international organization. Just imagine, how would my situation be? I would have been treated for malaria and then I just die off like that, Yeah, so I really got to appreciate what I had, But so yeah, I reached the hospital. I went to accidents and emergency. The cardiologist came, the associate, of this doctor, this cardiologist came. Yeah, they worked on me. I could not actually have the examination at that time or the test run that time, but they thought that I was suffering a stroke or something like that, because when they got the call from the airport, they thought I was, they thought I was having a heart attack or something, cardiac arrest or something like that. But then when they came to, I had to wait for the next day to perform all these tests, but they checked my vitals, everything was normal. The problem with heart issues is that you have to, there's something called a monitor, something like that. You have to wear it, because sometimes these things show, but then when you go to the doctor, they can't be seen. You get, it's just a moment. It comes like your heart palpitation come, and then when you go to the doctor, you'll be like, I just had a palpitation, please check me. And then when they check you, they find nothing, So at that time, they could not see anything. So they were like, you know what? We have to wait until the next day for you to start the whole process. So yeah, they never gave me anything, and the associate was clear. They were like, until they diagnose me, that's when they'll be able to treat, knowing that this is it, this is what we are treating, Yeah. So yeah, I slept, but then there was that calmness that I'm in safe hands, I'm in a heart and cancer center for like East Africa, there was that comfort, I'm in safe hands. So yeah, I slept, and then the next day, that's when they started running the tests, Yeah. It took 2 weeks. Yeah, it was, oh my gosh, like they'll keep you in this room. It was like a private room, and nobody understands what you're going through. Even the doctors have read the whole thing, but the whole fear, the anxiety, all these things, because the doctor told me clearly, listen here, there's no medicine for your condition. It's until we find the source, then we can be able to perform a surgery or a procedure. Then you can actually feel better. But right now you can't, because I can be on the bed and my heart just starts, you would see my heart pump out of my chest. You see the veins and all these things. But the doctors will just come and they'll be like, you'll be okay for a minute, Even sometimes they'll tell me, listen, yeah, your situation will deteriorate until we do something about it. And one cardiologist came inside, is like, you know what, you may suffer. You have high risks of heart attack. So every morning they'll take my blood samples, afternoon take my blood sample, evening take my blood sample. Just imagine those injections, And then I have the Holter on, the monitor on. I have the ECG, It was really scary in just that span of 2 weeks or 3 weeks, Yeah. Anyway, so after they ran the test and they found that I have a condition called mitral valve stenosis. Apparently, it's also rheumatic heart disease. So the doctors believe that when I was a child, I got a bacterial infection that affected my heart. And my heart healed my valve healed narrowly. So apparently, the normal human valve stretches 4 centimeters to 6 centimeters. So when I got sick and the valve healed, it got restricted to 1.2 centimeters. And growing up as a child, my body mass increased, so my body needed, I think, to pump faster and enough blood or something like that, yeah. So it was being much more visible. So this condition, I had it all along, but it was misdiagnosed as asthma. So all along I knew that I had asthma. You get what I mean? So my parents were treating asthma and all these things, yeah. But when you went through the diagnosis, the doctor said, actually, you don't have asthma, you have cardiac asthma, something like that, as a result of the underlying problem of the heart disease, yeah. So yeah, they found that it was mitral valve stenosis, and there are 2 procedures that can be performed: open heart surgery or the ballooning procedure, whereby a balloon is passed through your groin to your heart and then is inflated to open the restricted valve. Yeah, but then they had to do another procedure to confirm if I really need to do the valve. To do the ballooning, Yeah, so I had different cardiologists come in because there are different specialists, There's specialists of the valve, specialists of the open heart surgery, all these things, yeah. So the most scary thing for me and my family was the open heart surgery, Yeah, all of them you may risk complications, yeah, but the open heart surgery is when they literally open your chest.
Yeah.
And yeah, they perform that, yeah. And then the other procedures is just they put a machine or something, then they perform the surgery on screens and all that stuff, yeah. So further tests were performed so that they can be sure that it's either open heart surgery or a ballooning procedure, or a ballooning surgery, So doctors were still deciding on which is better for me. And that time, oh my God, I was praying. It's like, oh my God, open heart surgery is not what I want for my age. I prayed, oh my God, I was so close to God at that moment, Yeah, I was so close to God. I was thinking about my family, like everything just comes to you, Everything in your life just comes to you, and you get to realize that a lot of things are not important, Like when you're so close to death, a lot of things are just not necessary at that moment, Yeah, so that was it really. At that time, not everybody, actually not a lot of people knew that I was going through this. Just a very few people. Because I think I chose to. But then when I just told one friend, oh my God, the thing went like, shh, everybody knew about it.
I know who that friend is.
Oh, who's that? But anyways, it's okay. Anyways, I'm okay. I'm fine. Yeah, it was really hard for my family. Very hard. For me, hard. For everybody, hard. Yeah. Oh, yes. The day of the operation, the worst part of the operation is signing the consent. It's like it's like the doctor gives you this paper and they're like, you're aware that please be aware that this surgery is not like 100%, that you're going to go through this and this. These are the risks. They give you all the risks of the surgery. What could happen, what could go bad, you may lose blood, you may suffer this, you may suffer that. You sign that knowing that anything can go wrong. Yeah, so that is scary, You now see all these risks on your face, like, this could happen. But anyway, sorry. Yeah, I'm also used to mics, But anyways, you go ahead with it. Yeah, so that was the most scary part of the surgery. No, is it? Yeah, I think that was the most... kind of scary part of the surgery for me. Kind of, yeah. So on the day of the surgery was performed early in the morning. Yeah, so I got to be put on blood thinners, another lot of medications, and then, oh my God, my boyfriend was so supportive. Hush. Yeah, I was really supportive. Yeah, by that time, my mother and my father weren't around because like literally everybody was burying my grandmother and my auntie, We had like 2 people gone, and they were not yet buried. So it was really difficult for the family to balance in between these 2 tragedies, Yeah. So my boyfriend, my brother, and some other relatives that were in Nairobi were around, Yeah, so the day of the surgery, I got put in blood thinners and other medications, and then now they had to put you on anesthesia. Yeah, anesthesia, yeah. So that was the most peaceful moment in my life. Like, I want to be in that, okay, not the hard thing, but just sleep off and know nothing about what happened, yeah. So, I got put on anesthesia and just slept off like that. And when I woke up like 4 hours or 5 hours later, they said, oh, the surgery was successful, and then I got into ICU. I got monitored for another 2 weeks or something. 2 weeks. Yeah, I got monitored for 2 weeks. And then from there, I got, they had to run, like every day they were running tests. They were running tests on me to check that if the surgery was successful, you know. And yeah, I got sent home. And this, I've just been in Juba all along. Right now, okay, I don't know if other people that go through such big surgeries face it, but I've been suffering a lot with anxiety. Like, I'm always, I don't know if you guys have noticed, but most of the time I'm checking my pulse rate. You know, if I feel a certain way from my left side, I'm like, oh my God, I'm gonna die. I'm gonna have a heart attack and all these things you get. So I'm constantly on watch of my body, how everything is happening here. So it's really been, there's a lot of change in my body, and I'm struggling with it so much, you know. Some like really, if I start having an itch here, I'm running to the hospital, bro. Like, no, I'm going to the hospital, you know, like I'm dying, you know, or I start saying my last prayers, you know. It's just really scary, Kwaja. It's really scary. Yeah, but anyways, I appreciate life more. I appreciate my family more. You know, you realize that nothing matters apart from your relationship. I know I respect you, my friends, yeah, but God, you know, because even that period, it was God that pushed me through, because I was so depressed, you know. It was really scary for me, but yeah, I think my life has really changed a lot. I view things differently. I don't think at this time he would act. He's so young to comprehend it, like to understand whatever that is. I don't think because of course when you tell a child I had a heart surgery, what is a heart surgery? Oh, so you're gonna die. So what is death? So like you just go into this rabbit hole of trying to explain every word, you know, to him. So I don't think he's ready right now. Because in the same house whereby my grandmother died, people had to explain to him, because he was so close to my grandmother. So people had to explain to him the concept of death. So you get that? So I don't want to put him through that right now, because he may go through the same anxiety as me. It's like, oh, my mom would die. Oh, my mom will do this. You know, I don't want to put him that through. So he doesn't know really. When I feel he's old enough to bear it, you know, or to deal with it, yeah. I'm still, by the way, did I tell you that they told me I bought time? So I was given like a period of 7 years that I may stand the open heart surgery again. Yeah, so that I can have my valve replaced. So my head is still like in 7 years that I'm going to go through that roller coaster again. So life lesson on this exactly? On this story? Okay. Life lesson is that God first, and the rest comes after. And don't get married.